Good afternoon. I'm Dave Fredrickson. I run the Oncology Business Unit at AstraZeneca, and my team takes our potentially life-saving oncology medicines from our pipeline and works with doctors and healthcare providers around the world to deliver those treatments to men and women who've been diagnosed with a range of cancers, including lung, breast, ovarian, prostate, and many others. I've been leading this team for the past 3 years, and I am so proud to say that each and every person is relentlessly focused on following the science and addressing the needs of these patients. I'm going to be honest, when COVID-19 began to spread earlier this year, this mission, our mission, was truly put to the test like never before. I want to share with you more about how we faced that monumental challenge, but first I'd like to remind you of the incredible progress the oncology community has made in cancer care over the last few decades. Prior to the pandemic, death rates in cancer had leveled off, or even in some cases decreased, as patients increasingly took a more active role in their own care. The story behind these numbers demonstrates the incredible advancements we've made in identifying the right targets and genetic biomarkers to stop the progression of even the most aggressive tumor types, as well as the benefits of screening and early diagnosis. Nothing is more important in determining the course of disease than our ability to detect and act when cancer is still in its early stages. And generally, people understand the importance of early detection. But as the world went into lockdown, that idea was truly put to the test. The fear of contracting COVID-19 at hospitals and clinics overwhelmed people, and it became a powerful deterrent to patients seeking testing or medical attention for symptoms when they had appeared. In just a few months, the pandemic has potentially erased years of progress. The weekly number of newly identified patients fell by nearly 50% across 6 cancers: breast, colon, lung, pancreatic, gastric, and esophageal. The National Cancer Institute warned drops in screening for breast and colorectal cancer alone may lead up to 10,000 deaths in the next decade. Results from a study published in April suggest that the U.S. would see nearly 34,000 deaths from cancer in the next 12 months. And finally, according to the AACR, a recent survey of patients with cancer found that 79% of those who are actively undergoing treatment had to delay some aspect of their care as a result of COVID-19, including 17% who reported delays to their cancer treatment. The pandemic could truly set us back 10 years, and that is not acceptable. But I am proud to say that as a cancer community, we aren't accepting these trends as an inevitability. We've pivoted, we've adapted, we've moved quickly to launch a range of strategies to mitigate the impact of COVID-19, embracing our responsibility to continue to care for our current patients while maintaining momentum around screening and early diagnosis when the difference between life and death can be decided. We are faced with challenging circumstances, but also unique opportunities to evolve cancer care in ways that will have a positive, lasting impact. Under this enormous pressure, we made some fast but considered choices, and what's interesting is those choices led to advances which may grow into opportunities that are fundamentally able to evolve and improve cancer care on a societal level. Let me walk you through some of the innovations we've made at AstraZeneca in response to COVID-19, and they span across 3 critical areas. First, remote care, including home testing and treatment. Second, a patient-focused approach to clinical trials. And finally, third, partnerships with governments and advocacy groups. Let's start first with remote care. At a time when few people could leave their homes, we focused our efforts on providing access to testing and treatment at home. Prior to the pandemic, we began work on an integrated oncology patient management platform and for healthcare professionals, patient groups, and care centers. It's a platform that collects data through telemonitoring, teleconsultation, and home care services through a single interface which can be accessed via your PC. Through this platform, patients are receiving a more personalized care plan and real-time monitoring of their disease while their doctors continuously track their health and get immediate alerts when there's any kind of impediment to their care. This gives them the opportunity to quickly adjust and customize their care plans and all of this can be done remotely. COVID-19 significantly accelerated our timeline for development, and now we're rolling out this platform internationally in the coming months. Platforms like this represent the future and the next wave of healthcare delivery and management. On a separate testing front, we immediately went to work to provide alternatives to healthcare facility-based biomarker testing. Between March and September, we were able to reach close to 2,000 patients across Brazil to Mexico, CAMCAR, and Argentina. Furthermore, some of our medicines, like our immunotherapy treatment, require infusions in a hospital or clinic. The FDA granted a priority review designation for this medicine, which would enable some lung and bladder cancer patients to reduce required medical visits by up to half. We're working with health authorities in the US and around the globe to bring this option to patients as soon as we can. We rolled out a home delivery and administration service for prostate cancer patients, beginning in the Australian market. With 80% of men receiving treatment being over the age of 70, they are at serious risk of developing COVID-related complications. A home injection patient support program was essential for their continuity of care. Turning to Singapore, which has the most cases of COVID-19 anywhere in Southeast Asia, we initiated a collaboration between AstraZeneca, hospitals, and home care nurse provider Jagami to ensure the best cancer care was still available to patients during COVID-19. This includes blood draws, injections, and select treatment procedures. Secondly, a patient-focused approach to clinical trials. A very small portion of AstraZeneca's clinical trials in oncology have been impacted by the COVID-19 pandemic, with disruptions being largely limited to earlier stage trials. To maintain our trials, we had to become even more flexible, more adaptable, making it easier for patients to participate through telehealth, delivering medications directly to their homes, and fast-tracking the implementation of digital technologies to closely monitor trials in real time. When we remove the need for patients to travel to hospitals on a regular basis, we can innovate ways to gather data more effectively and efficiently while removing the strain on hospitals. From an R&D perspective, these changes are making us more efficient. Our control tower includes COVID-19 reporting, accessible to 6,000 R&D colleagues, providing automated daily updates on the impact from COVID across every internal clinical study, recruitment by country, supply, missed visits, and more. Thirdly, partnership with governments and advocacy groups. As we adjusted to best serve patients during the pandemic, we knew we couldn't do it alone. For maximum impact, government, industry, and advocacy groups have to all come together in order to create lasting impact. To that end, there have been a number of ingenious approaches to ensure timely cancer screenings. One of which is a retrospective lung cancer screening in Russia, where hundreds of thousands of COVID-19 scans were analyzed by the Moscow Center of Diagnostic and Telemedicine Department via AI to determine if signs of lung cancer are present. The concept of this program was created in collaboration with AstraZeneca. While this is not an AstraZeneca program, we look to these types of initiatives as inspiration, as they will have utility beyond the pandemic. They will likely increase the proportion of newly diagnosed lung cancer patients in early stages, and may support lung cancer screening and program implementation across the country and encourage the implementation of AI in routine care. In the US, the Centers for Medicare and Medicaid Services has revised guidelines to allow healthcare providers to treat Medicare patients in the home setting and to be reimbursed for infusions and more medically complex treatments that are typically administered in a healthcare center during the COVID-19 public health emergency. This, we hope, will pave the way for more point-of-care flexibility, such as home infusion services and fewer hospital visits. Beyond this, we've been working with patient groups, physicians, and local media to encourage patients and those that have yet to be diagnosed to return to care and screening. In the first stages of the pandemic, AstraZeneca engaged with the global patient community and learned of their deep concern that more cancer patients will die because of reduced care during the pandemic than COVID-19 will sadly kill directly. In response to this feedback, we partnered with global patient coalitions representing over 650 patient groups and more than 14 million patients from around the world. And the purpose was to build a platform to deliver the message that patients whose care had been interrupted need to re-engage with the healthcare system, and people with suspected symptoms or those who have missed a cancer screening urgently need to safely see their doctor. The campaign, New Normal, Same Cancer, urges cancer patients to return to cancer services following the disruption to care due to COVID-19. It centers around 3 simple actions. Don't wait, contact your doctor, get checked. The public awareness campaign encourages people to prioritize a return to screening services, resume treatment, and to see a doctor with any concerns of potential symptoms or if a routine check has been missed. It'll be rolled out on a country-by-country basis as healthcare systems are ready to receive patients. As part of the campaign, we're calling on global healthcare leaders and policymakers to ensure low COVID risk pathways are available for patients to seek screening and care, and that there is sufficient diagnostic and treatment capacity to meet the projected needs of patients. COVID-19 has changed all of us in ways we haven't even yet begun to fully understand. I'm so proud of my team and the larger oncology community that's honed in on caring for some of the most vulnerable members of our society, cancer patients. And we've done this in the midst of a global pandemic. We're still in the middle of this crisis, but already our robust response is resulting in improvements to our healthcare system that should remain and even further expand. We're partnering across the industry with governments and organizations to save lives by raising awareness on testing, staying on treatment, and safe pathways to care. We're creating better access to testing and treatment through home delivery. We're simplifying participation in clinical trials through patient-centric efforts. And we're maximizing technology to provide more effective monitoring and faster, more customized responses to patient needs. Our ambition to cure cancer has not been diminished by COVID-19. In fact, it's just the opposite. This pandemic has strengthened our resolve, and we are working day in, day out on early detection and treatment to give patients the best chance at survival. Cancer remains a global challenge, and we will embrace the progress made in the new normal to defeat the same cancer. Thank you very much.